Hello and welcome back to In Pursuit of. I am continuing my conversation with Tanuja Joshi, Managing Director of Venu Eye Institute, and she is in pursuit of good sight and healthy living for all. So welcome back, Tanuja.
Thank you.
Pleasure to have you here. How did you start this journey?
I think not all courses in life are charted out. Some of them are pure destiny. And in my case, I think it was just divine intervention. So I was actually working on a documentary. I was scripting, editing, and filming a documentary, and the subject was cataract. I was given the name of the ophthalmologist who would be my technical guide. I didn't realize he'll end up being my guide for life. When I used to go to the hospital to shoot, I used to see him at work, and I was extremely inspired by his selfless dedication to the service of his patients. And the film that we did on cataract, the documentary, in those days it was only Doordarshan. And Doordarshan aired it after the English news and cut off the credits.
Right.
And Dr. Seth, the founder of Venu, would get calls from people saying, oh, what a wonderful effort. Because those days, there was hardly any educational work happening in medical areas. So he reached out to me and said, let's do a series of these films more. So I came as a volunteer. And here I am after 40 years. And I must say, I've never ever regretted my decision, the choice I made then.
That's quite incredible. From there to now, there must have been, you've seen the entire journey of the Institute. Do you want to sum it up in like 2 lines?
It has been an extremely interesting journey, full of challenges. But then I was taught by my mentor that challenges give you opportunity. And that is what has been my learning experience. Unfortunately, I only had 8 years of working with the founder. We lost him very young. He was only 56 in 96 when we were at a very delicate situation when the Institute lost him.
So as a managing director in this role, what are the unique challenges that you face?
I think one of the unique challenges, or I would say, is I'm a non-medical. And I think it's not just in the medical field, but I think in any professional field, there's always a friction between the professionals and the non-medical or the non-specialist, I would say.
Right.
So that definitely is a challenge. And the second is being a woman.
Really?
I think that is definitely, even today, the gender issues are there. Not having any management degree, whatever I learned was on the job. So I think these have been and continue to be sometimes a challenge.
As a woman, like I can imagine now everybody's talking about it. But 40 years ago, it must have been really hard.
I think it was a situation where people didn't have much of a choice, because what happened is when we suddenly lost our founder, we used to be working out of a rented house in South Extension. So he had been able to get the land that we now have our house, the institute in. So he had laid the foundation with a lot of pomp and show. And in that event, he had also announced his departure, where he had said, that now I'm leaving it all to all of you to bring it up. But none of us really registered or even realized what he was saying. So he laid the foundation. We had no money. He was not there. So all the people who were supporting him or believed in him, suddenly with his going, they all took a back seat. But because they were emotionally connected to him, they didn't want to abandon it either. But nobody was ready to take the role of the, bringing things back on track. So I think at that time, I was the person who took it over. And so they were happy to assist, but nobody was taking it over. I think that gave me the opportunity to fulfill the dream that he had left incomplete. Yeah.
We know that medical, support is not really available in rural communities, and government support is also minimal. In all these years of working, you must have figured that the government could have helped in this, but we have to figure this bit on our own, or it's hard for the government to do X, Y, Z. What are those things?
So very interestingly, when you look back, I think even pre-independence, if I go back, somewhere eye care has always been a social service. Majority of the work has been done by philanthropists, whether it was a trust or an individual, the social service that they used to do was organizing eye camps.
Right.
Also because eye surgery could be done in a rural setup.
Right.
You can't do a heart transplant, you can't do any other surgery, but eye surgery, cataract surgery, was something that you could do at the rural level. So traditionally, a lot of eye care has been done by the non-governmental sector. Even the government acknowledges that when the government says, there's so much, let's say 60 lakh cataract surgeries have been done, a large chunk, almost 60% would have been done by the non-governmental sector.
Wow.
So the government has been supporting. They do have schemes and grants that support the free work. The challenge is always that there's always delay in payments.
Right.
So definitely, I think one of the areas that the government can focus on is to make sure that the work done by the non-governmental sector is reimbursed timely.
Yeah, that would be at least the least they could do.
Yes.
So Tanuja, tell me, how do you collaborate with other health organizations to ensure the effectiveness of your interventions?
So one is that we definitely need support when we go for advocacy.
Right.
And awareness. Also, when we want to reach out to the community with our services, we network with either a trust or a society or even RWAs. It could also be a Rotary Club. It sometimes also, in the rural areas, you have these mandis, the vegetable market traders. We partner with them because while we take our technical services, somebody has to do the groundwork, whether it's in terms of publicity, local arrangements. Also, the confidence of the patients come in us when there is a local person they recognize and they believe, because we're definitely an outsider. When we start with, over a period of time, they get to know us. So we network with all these different partners we need for any work that we do outside the campus.
How do you finally gain trust in the community? What happens?
At the end of the day, the only thing that will give you the trust of the patient is your quality of service. And in eye care, once you operate, either the person sees or doesn't see. So the results are immediate. So at the end of the day, definitely is the quality of your service. And added to that is also the way that you're giving. Are you giving it with a lot of compassion, or are you just being very clinical about your services? So the one thing that I'm very happy that patients give us a feedback that when we come to Venu, right from the gate to every level, we are treated with so much of care and love. It's very interesting that when we bring patients from the rural areas in our buses, we transport them. Very often when they're leaving, they're very sad. Not sad because they've regained the sight, but they said that the love and affection that we got here, the way you served the food, people talk to us. And this is not a problem of the urban areas where the elderly are neglected. This is today a reality even in the rural areas. They said we don't have anyone who even प्यार से कोई हमें रोटी तक नहीं देता है घर पे.
Oh.
So the whole experience that they go with is, so it's definitely the quality of your service and the way and the manner in which you have delivered the service.
How can any individual or organization support your mission?
So one is by helping us in spreading awareness. The other is we are very now active on our social media, because that's one medium with which you can reach out to the people. So we are constantly posting tips on eye care and also in lifestyle diseases. So if people can share that, and if they can also reach out and help us organize and reach out to more patients with our services, whether it's through the camps. And at the end of the day, we also need funding.
That's true.
So sponsorship of the work, the free patients that we operate, that also is a way that a common man can help us. Even a small amount helps impact one life.
What message would you want to give to our audience? Our audience is quite young, when it comes to good eye care and healthy living, which is your pursuit.
Especially when you're talking about the younger age group, is managing your lifestyle. Because the moment you become a hypertensive or a diabetic, it affects and impacts your eye. And at the age of 40 plus, those manifestations start happening. So be regular with your eye checkup so that the symptoms can be caught early, the disease can be caught early and managed early. and definitely I would say managing your lifestyle.
So just to touch upon the detail of what kind of eye issues happen if a person is diabetic or
Diabetic
hypertensive.
retinopathy. So what happens is that the retina is the most sensitive part of the eye. So it's like typically like a camera. You know, you have the lens and you have the film. Now, of course, you don't have a film. In the good old days, we used to have a film. So retina is the film in which the image is formed.
Sure.
The moment diabetes happens, any organ connected with the blood vessel gets impacted. We understand how it impacts your heart or your kidneys, but the first organ that it affects is your eye.
Really?
And any damage that diabetes causes in loss of sight is very difficult to recover. And in the case of blood pressure also, the sudden fluctuations of blood pressure can impact your blood vessels. They can be hemorrhaging. So in the long term, the effects of blood pressure and diabetes impacts heavily on all organs of your body.
Right.
In fact, we've had very interesting cases when a patient has come and during an eye examination, the doctor tells them that get your blood pressure checked, get your sugar checked. And they say, but why? We don't have it. And he says, go get it checked. And then they go back and they come and they say, yes.
I don't think most people know that the eye is probably the first
It is the
organ
window
that gets
to
affected.
the body. Yes, it is.
My goodness. Well, thank you for that. And I hope our audience is listening in and carefully and they keep a check on that.
Thank you. Thank you for calling. And I do appeal to all your audience. Please focus on healthy living.
Lovely. And now we have a naturopathy center right
Yes.
there at Venu Eye Institute.
Yes,
Lovely.
yes. Which helps you address the root cause of problems.
Thank you, Tanuja. Pleasure having you here. Thank you for watching and do remember to subscribe to In Pursuit Of.